It made no sense. There were two maternity clinics at the Vienna General Hospital. Their quite unimaginative names were the first clinic and the second clinic. The same obstetric techniques were used to deliver babies at both clinics. Clinic staffers would assign patients randomly on even days to the first clinic and on odd days to the second clinic. Yet the maternal mortality rate, the rate at which women died shortly after childbirth, was typically more than twice as high in the first clinic as in the second clinic. In April of 1847, the maternal mortality rate at the first clinic had reached 18.3%. Almost 1 out of every 5 women died after giving birth there. As chief resident of obstetrics at the Vienna General Hospital, Ignaz Semmelweis was in charge of both the first clinic and the second clinic, and he was baffled by the tremendous difference in maternal mortality rates between them. Semmelweis considered the factors at play. There was no statistical difference between the women admitted to each of the clinics because distribution was random. Overcrowding wasn't a factor because the second clinic was always more crowded, and that was the clinic with a lower mortality rate. The only difference between the clinics was that doctors trained medical students and had them assist with patients in the first clinic, while at the second clinic the doctors trained midwives and used them to assist. But why would that make a difference? The breakthrough came, alas, because of a tragedy. Semmelweis' good friend, professor of forensic medicine Jacob Kolechka, died shortly after a medical student pricked one of his fingers with a scalpel during a teaching autopsy. When they performed Kolechka's autopsy, it showed a similar pathology to that of the women that were dying after giving birth in the first clinic. Semmelweis connected the dots. His friend died because a scalpel that had been inside a corpse had penetrated his skin, and he died from the same disease as the women in the first clinic. As you remember, doctors trained medical students at the first clinic, and this training often involved cutting into cadavers in the autopsy room, which the medical students often did right before examining patients. Meanwhile, the midwives in the second clinic were not engaged in autopsies and had no contact with corpses. Semmelweis didn't understand exactly why, but he knew there had to be a connection between the cadavers and the increased maternal mortality. Semmelweis came up with a theory. The medical students carried what he dubbed cadaverous particles on their hands from the autopsy room and deposited them on the obstetric patients they examined, making them sick. Remember, this was the 1840s, and the germ theory of disease was still decades away. So established scientific medical understanding did not explain what Semmelweis was proposing. Undaunted though, Semmelweis instituted a policy whereby the medical students would wash their hands with a chlorine solution between autopsy work and the examination of patients. The result? The mortality rate in the first clinic declined 90% and became comparable to that in the second clinic. As I mentioned, by April 1847, the mortality rate had reached 18.3% in the first clinic. After Semmelweis instituted hand washing in mid-May, the rate in June dropped to 2.2%. It went from 18.3% to 2.2% in 1 month. In July, it was 1.2%. In August, it was 1.9%. The mortality rate at the first clinic finally matched that of the second clinic. So, Ignaz Semmelweis became a hero. The medical establishment accepted hand washing and general hygiene as fundamental infection-fighting techniques, and the rest is history. The medical profession wasn't ready for Semmelweis' hypothesis. In fact, they ridiculed, ignored, and dismissed it. Why? Well, first, there was no established scientific basis for his conclusions or his results. To make matters worse, Semmelweis was prickly and a poor communicator. Also, he was Hungarian-born at a time of high tension because of the Hungarian Revolution of 1848. In addition, some doctors became offended at the suggestion that they should wash their hands, taking issue with the very notion that the hands of gentlemen like them could be unclean. But the biggest reason the medical profession did not embrace Semmelweis' practice, despite its indisputable results, was belief perseverance, also known as belief persistence, which is a psychological tendency to maintain a belief despite recent information that firmly contradicts it. Such beliefs may even be strengthened when others present evidence debunking them, a phenomenon known as a backfire effect. This tendency to cling to discredited beliefs doomed Ignaz Semmelweis' hypothesis and continues to plague human beings to this day, hindering scientific progress in many areas. In a textbook example of the backfire effect, the Vienna General Hospital administrators dismissed Semmelweis, and the Vienna medical community harassed him until he decided to move back to his native Hungary. Outraged by the reception of his hypothesis by the medical profession, Semmelweis began writing angry open letters to prominent European obstetricians, denouncing them as irresponsible murderers. His contemporaries, including his wife, believed he was losing his mind. In 1865, two of his colleagues forcibly committed him to a lunatic asylum where he was beaten by guards and died of septic shock only 14 days later. He was 47 years old. Around 20 years after they dismissed Ignaz Semmelweis from Vienna General Hospital, and right around the time he was languishing in the asylum, French biologist and chemist Louis Pasteur confirmed the germ theory of disease. Semmelweis's cadaverous particles turned out to be germs. A few years later, British surgeon Joseph Lister, acting on Pasteur's research, used hygienic methods to operate with brilliant success. Semmelweis's antiseptic procedures finally gained widespread acceptance, and Semmelweis himself, belatedly, became recognized as a medical pioneer. You could make the argument that Semmelweis was simply ahead of his time, that the foundational science, the germ theory of disease, was not there yet to support his real-world observations, conclusions, and results. But Semmelweis's results themselves would have spurred the quick development of that science were it not for belief perseverance, which delayed the confirmation of germ theory for decades and led to the needless deaths of countless medical patients. Belief perseverance also, of course, totally ruined Ignaz Semmelweis' life. And to add insult to injury, literally, that same psychological tendency to reject new evidence or new knowledge because it contradicts established norms, beliefs, or paradigms is also known as the Semmelweis reflex. If you don't know the story and you hear something is known as the Semmelweis reflex, you would naturally think that Semmelweis characterized such thinking, not that he was a victim of it. I'll leave you with a tragic side story. Gustav Adolf Michaelis, an obstetrician in Kiel, Germany, read about Semmelweis' theory in 1848. Unlike most of his colleagues, he adopted the practice of chlorine hand washing. He realized it worked, but he also realized that because of his previous unsanitary obstetric practices, he was responsible for the deaths of a number of women, including a beloved niece. He sank into a deep melancholy and threw himself under a speeding train at the age of 50. I'm Jack Azur. Thank you for watching.